So I'm super excited to have Kathy here about CMS. Because a lot of why we wanted you to be here, Kathy, was that we've had just a lot of conversations about challenges with healthcare and especially when dealing with fetal alcohol spectrum disorders. And so some people in the group have CMS, some are not sure if CMS is the right insurance for them. Some don't know what it is. And so we wanted just information. So Kathy, maybe you could just start off just kind of explaining it, and I'm sure there'll be time for people to ask questions.
Okay, yeah, I'll go over a little brief thing. So my name is Kathi Coiro. I am a nursing supervisor with Children's Medical Services, Department of Health. And right now my role is I'm a supervisor for our Title V team, and then also, and that covers Tampa down through Naples. And then I'm also a supervisor for our medical foster care team, which is Southwest, which is Sarasota and Fort Myers area. So, and then Children's Medical Services, of course, is evolved over the years, and we do have other programs, just so you know. There's Early Steps, the Child Protection Team, the Poison Control Centers, and then also a lot of programs at the university centers for like high-risk OB, kidney failure, cancer, craniofacial, those types of things too. So then the other part of CMS is this managed care plan. So, and the managed care plan is operated through WellCare. So those of you that are on it probably know that. So our local CMS office here in Sarasota, where I am, we closed back in 2019. So everybody's working from home. And at that point is when WellCare took over the management of the plan. So a lot of the nursing staff that we had moved over to the WellCare side of the plan and are doing the case management. So prior to that, we did local, those of you may know, we did local clinics, mostly either at Sarasota Memorial or at All Children's, but now all of the services are given in the private doctor's offices. So WellCare manages the plan, and they have their teams of case managers, and the children are assigned to a case manager, and then the case manager is to help the families find the doctors they need, the specialists, make sure they're with a medical home or primary care doctor, help them find their equipment, can help with making sure authorizations go through, and things like that. So let's see. So the CMS plan goes from birth to 21. So children are eligible up until their 21st birthday is when it is. So we have our Medicaid. It's the Medicaid Managed Care Plan, the MMA plan, and it's under the specialty plans, not the traditional plans. And then also we work with Florida Kid Care. So if a child's eligible for Florida Kid Care, they can also be eligible for the CMS plan. So, and typically those are families that are paying the small premiums for their plans. Okay, so the eligibility though is handled through our CMS central office. So WellCare does not determine the eligibility for the children to be on the plan. All the kids have to be screened through the CMS central office, and they have a group of nurses that do the screening, the eligibility screening. And it's just basic questions, and most of it is, is your child do things that are appropriate for their age that other kids would be doing, and do they require special services? Are they in therapies? Generally, if you answer yes to all of those, then the child ends up eligible. But the eligibility specialists go through that. And then once an eligibility is determined, that information goes to Medicaid if the child has Medicaid, or it goes to Kid Care if the child has Kid Care. And then from there, The enrollment with the kid care, it's automatic. So if you screened eligible for CMS and your child has kid care, then automatically, like probably the next month, they would be enrolled in the CMS plan. And the services are the same, whether you're on kid care or Medicaid. And then if you're on Medicaid, this is where it's a little different. The family has to actually choose the plan. So they have to call the choice counseling line and then choose the plan. And then Medicaid will enroll them in the CMS plan, the specialty plan. Let's see. So under WellCare, through the benefits, the services are the same. There's basic services for all the Medicaid managed care plans. And then they have these, so it'll cover therapies, specialty visits, diagnostic testing, office visits to the specialists, primary care doctor, which, you know, they want everybody enrolled with a primary care doctor, medical home. And then there are extras that the plan does cover, which a lot of the Medicaid managed care plans do have extra benefits outside of what Medicaid will pay. So some of them include food and housing allowances, but you have to qualify. I don't know. And they make that determination within the plan. And then they, non-emergency transportation is covered, like transportation to doctor's visits. They also will allow for swim lessons for the prevention, for drowning prevention. And then, of course, the therapies. ABA therapy is not in the MMA plan coverages. That is an outside coverage, and it goes through an authorization process through EQ Health is what they call it. So, but it's still, you know, covered services. Anything, because children under 21, anything that's medically necessary should be covered by the plan, no matter what plan it is, actually, but it has to still go through an authorization process. And that's where some things get a little bit fuzzy, because the doctor may order something, but it still has to be proven to be medically necessary. So let's see. And then the other thing
Kathy,
is,
can I just to stop for a second, just to get clarification. So going back to the difference of CMS versus traditional Medicaid, first of all, they have this case manager who can kind of work with the family and so with the providers to make sure they're getting the necessary services.
Right. The case manager is assigned, and the families can call them at any time to ask questions or to find out where providers are, help with finding equipment. And I think all the plans do have case managers assigned. I think it depends on the level of care that the child needs. But with the CMS plan, the case manager is always there. And they, let's see, they have a certain frequency that they have to contact families also and make sure that things are going okay. And also the CMS nurses can come out and make home visits. So it is a statewide plan, because right, not all of you are in this area here. So it is a statewide plan. So there are staff all over the state. And all those nurses do work from home. And then there's WellCare has these welcome centers in certain areas that if you needed something, you could go to the welcome center. But generally, everything's done over the telephone. And then if necessary, the nurse can come out and make a visit, but they don't do like hands-on care, but they can help find nursing agencies if you needed help in the home. So the thing with the CMS plan, the WellCare CMS plan, is that it is children only, where the other Medicaid plans are like adults and children. So this one is dedicated strictly for the pediatric population, so birth to 21. So these nurses are familiar with the needs of children. You know, you're not dealing with somebody who has a caseload of adults or maybe also children too. So that's probably a good thing. But everything does get, if it's medically necessary, the services would be covered. The problem would be maybe you'd have to still stay within the plan for the providers. So you'd want to, just check that out before, to make sure if you weren't on the CMS plan now and you wanted to be, just make sure that your providers do accept the CMS plan, because you don't want to lose what you have if they're not on the plan.
So for eligibility, how difficult so let's just say, I know there was a question with Crystal where she had, she's got her sons that have CMS because of prematurity that happened, but she also has her daughters who are also have FASD, but they're 17 and 18.
Right.
And going back to these, there's a lot of challenges with these kiddos. How difficult is it to qualify for CMS, especially when they're older? And
yeah, I would think they would still qualify as long as they still needed some assistance and they have some delays. If they have delays, then they probably would qualify or require therapies or, extra care. Then they would qualify, and they would be on the plan until they're 21. That, and the other thing that the case managers can also help with is healthcare transition. So that transition from being in the pediatric population going to adult services. That's another thing that the case managers are familiar with, because that's a difficult thing, especially when they're getting to be 17 and 18. You want to find a more adult providers. So there are adult providers on the plan, even though it's a pediatric plan, because they want to make those transitions easier to keep those kids, safe and healthy as they're growing there. Does that help? And I'll send you the information on the providers and stuff. There's a list. There is a provider directory on the the CMS WellCare website. So there are provider directories so that you can see. I mean, they try and keep it up to date as much as they can. Some doctors will say their panel is full or something like that. But yeah, and I see the question about the behavioral health services. Yeah, that is a tough one. There are providers in the plan, but I think all around the state, it's hard to find behavioral health services. But I'll send you, Tamara, I'll send you a link with a document with the links to the provider directories so that you can look those up a little easier. But it is it's Children's Medical Services WellCare. If you look it up that way, you'll be able to get right to the website. And then the provider directories are listed on there. And then it also gives, go ahead.
Yeah, I had a couple of other questions for you. So some of the families that are in our group, there's international adoptions, and so they don't automatically get Medicaid, but they still have the same special needs as a child that's in foster adopted world. But going back to it sounds like if you can document a disability and a delay, it's not that complicated to get CMS?
Good. No. So we have the plan under Medicaid and Kid Care. So those are the ones that have financial eligibility. And then the medical eligibility is determined by CMS. CMS also has, which is not operated by WellCare, has a safety net plan. So for kids that either are uninsured or underinsured, CMS does have what we call a safety net plan. It doesn't pay for everything, but you can, it's still the medical eligibility and the financial eligibility. And then CMS would cover like specialty doctor visits, medications, some therapies, but it requires another layer of approvals, or PPEC services, or low protein foods. That's another thing that's covered under that safety net plan. But that would probably be another place where children that are not right, that have been adopted outside, you know, and can't get coverage, maybe is another way to get at least some of the care covered. It doesn't cover primary care visits or like the immunizations or, you know, things like that, or sick visits, but the specialty care would be covered.
So there was a question in the chat box, if you can go over the housing allowance.
Housing allowance, yeah. And unfortunately, I don't know enough about that, how much it is. And I'm not sure, I think it's per year. Wait a minute, maybe I might have it here. Let's see, they have an over-the-counter benefit that gives you $25 worth of over-the-counter medications. There's the swimming lessons. The housing allowance, is up to $250 a year per housing assistance, and then up to $75 per quarter to purchase healthy food items. It's something that you would have to apply for, that you talk to the case manager about to see if that could be done. They also do meals, but that's only if you're being discharged from a hospital or a nursing facility. And they do provide services for caregivers too, like behavioral health services for caregivers. It's limited, but they do try and provide some services for the caregivers.
Oh, wait a second. Wait, I have a question then, Kathy.
Yeah.
Just because of traditional Medicaid, so let's just say providing therapy, we only have a certain number of units you could see a family within a year. So do you have, with CMS, there's extra units you can use for specifically the caregiver?
No, this one is behavioral health counseling.
Yeah, it would be mental health, behavioral health counseling. It would be.
Yeah. But there are, for the children on the plan, as long as it's still medically necessary, then these things are generally approved. So if, I know Medicaid has a limit even of regular therapies or whatever, but if it's for a child and, you know, the documentation is submitted, then they'll approve it for as long as the child needs it and is making the improvements for that part. Let's see, the behavioral health services for caregivers, it's education and training for patient self-management by a qualified, is what it says, non-physician healthcare professional using a curriculum and 30-minute face-to-face sessions. So it's not really it's just to help the caregiver provide the services to the child or support for the caregiver. Yeah. But I'll send that list to you too, so you can share that.
Yeah.
Of all these. It's actually on the WellCare website or the CMS plan website. But I'll send that so that you have that list of the additional benefits that are given. I mean, all the MMA plans do have some additional benefits. I think that's just part of what Medicaid required of them, to provide a little bit extra, but these are more family directed and more directed for what children need, I would say.
So just to go back to the pros and cons of CMS versus traditional Medicaid, it sounds like, I mean, so there's some additional things that you're covering.
Right.
And what would you say would be the cons?
Well, it would be the provider, to have your provider in the network.
Mhm.
That would be, that to me, that's probably the biggest thing, because you've established your services and you don't want to lose what you have, especially if a child's in counseling.
Right, right.
That's the difficult part, to have to change providers. The specialists, most of them are in network, I would say, the pediatric specialists, but it's the counseling and the therapy, like even just OTPT speech type of therapies. No, I mean, the other is the requirement for like either face-to-face meetings with the case managers. Some families don't want that intrusion in their lives, to have somebody calling them and checking with them every 2 to 4 months, so that sometimes, believe it or not, families don't want, but for the most part, to me, that would be helpful, I think. But let's see.
Does anyone have some questions? Anyone have any? Oh, Pam? You could just go, yeah, you can unmute yourself.
Okay, so hi, I'm Pam. I'm the one that
Hi.
wrote the question about Dr. Salgado.
Oh, yes.
And I'm currently paying out of pocket to see her because she's not covered on my husband's plan either.
Oh,
So if my son were able to get on CMS, could I continue to pay out of pocket if she's not on CMS, but his prescriptions might be covered?
right. Well, and would your child be eligible for Medicaid?
Well, I think he will be. I
Hmm.
think he will be based on what you've said. But like that's
Okay.
the first assumption, he'd be
Right,
eligible for
right.
CMS. So
Yeah.
then you see, like, I wouldn't be losing anything, but it's just so expensive on my husband's insurance plan.
Right. Right.
That's $1,000 a month out of pocket. So so I guess the way I'm looking at it is, I wouldn't, if I could still go to her, even if she's not a CMS person, would the prescriptions be covered?
It would depend, because the Medicaid gets kind of fussy, or they have rules about medications and who prescribe them. So currently, you have to be a Medicaid provider in order for Medicaid. You have to be a Medicaid provider and the prescriber in order for Medicaid to pay for the prescriptions.
All right.
So
That's a big deal.
yeah, but you might want to then look into this safety net program, and I'll send that information, because perhaps you would qualify to have like help with prescriptions, even though
Okay.
I'm not sure how that will work, because I don't make those determinations anymore. So, but it's probably well worth looking into to see if the safety net program could maybe cover the prescriptions. Yeah, and I know Dr. Salgado is very good. And she was a provider with us, but things change, the services change. And I don't know if even under the plan, it has been Sunshine bought out, or whatever they did, WellCare and Stay Well. So they're all under this big umbrella now. So those changes are going to happen, I think, in October. So, but I'm not sure if the providers then have to become Sunshine providers, or they'll stay under the WellCare. So, that little piece could be changing. And I don't know because Dr. Salgado did take Medicaid, I thought, but
He may, I haven't asked.
yeah.
I'll ask.
So there's changes coming around there too. Just, if
Thank you.
that's the piece, but yeah.
Okay.
Right. And you're welcome to call me. I put my number in the chat there. Anytime. Yeah, you know what? I'll put my email in too. So then you can always email me questions or whatever. I've been with CMS for a little over 30 years, so we've had a lot of changes. And I used to come to the Florida Center when I was working with early steps. So, I had a caseload of children that were in early intervention at that point. So, yeah.
Now I have a question for you also, Kathy. Just how complicated is the process to get CMS? Is it a pain? Is it easy for families?
No, I think it's easy. There's if you're, once you are screened eligible, then it goes, there's a designation that gets put into the Medicaid system if the child has Medicaid, and it stays there. So at any time you can then call choice counseling with Medicaid. That's the only complicated part, I think, is that it's still, you talk to the CMS staff, you answer the questions that's determined that the child is eligible for the CMS plan. Then that information goes to Medicaid, and they put a little designation in the child's record in Medicaid. And then after that is done, the family can call Medicaid, the choice counseling line, and say, I want the CMS plan. And then usually it happens with the next month for the enrollment, because they don't usually put anybody on in the middle of a month. So it's always going to end up being like the first of the month. There's certain cutoff dates that Medicaid has, but they're usually like the third week in the month. If you call after that, you have to wait to the next month. So almost a month and a half later to get on, but it's not complicated to get on the plan itself. It may just take, a month or so.
Okay.
Yeah.
Any other questions for the group?
I have a question.
Sure.
What types of therapies are covered? So is it only like mental and physical therapies, or would it be something, well, I don't know if this is mental or not, but like educational therapies from licensed
Education,
providers?
right. There is on the extra benefits, there are some like tutoring services that are covered, but I can't really tell you what exactly the tutoring would involve, what that would be. But generally it's the OT, the PT, the speech therapies that are covered. But, sometimes the OTs do a little bit more, educationally based, or PTs too, whatever, or speech, whatever. So some of that can get covered, but it would be depending on the agency and how they submitted their authorization. But in the extra benefits, there is a little section on tutoring also. I don't find it on the one list. Oh, they've got a little plan. Oh, tutoring services. You can get up to 12 tutoring sessions to help remove any educational barriers. Then there's something else they call Steps to Success, something else to help with reading scholarships. And also they offer GED testing coverage.
Jen Worden, I think you had your hand raised up.
Yeah.
So my little guy was adopted from foster care, so he
Mhm.
automatically has his Medicaid if he qualifies for CMS due to the needs of his services at this moment, and then he progresses, makes progress, no longer needs the additional services, is it a difficult process to make sure, like, does he need to come off of CMS and then go back to his prior Medicaid plan? Is that an easy transition? Because I don't want to make life any harder than it already is.
Yeah. So basically, you opt into the plan because that's the parent choice. You can also opt out. So if you no longer want to be in the plan, I think you just call the eligibility screening people and they'll put a little note in, or you call Medicaid. Actually, if you're already in the plan, you call Medicaid and just tell them you want to change plans. That part is easy. So you can either opt in or opt out. And same with if you're enrolled through Kid Care too, you can just opt out of the plan if it's not working or whatever. So it's not, you may have to wait till the end of a month. Like I said, generally things don't change in the middle of a month, but can be done like the first of a month.
Thank you.
Decide. Yeah.
Someone was asking me, how good is the network? Like, are there enough providers accepting the plan? Is it adequate? Or do you feel like that's?
No, I in a lot of the more concentrated areas, the bigger cities have more providers. I mean, that's for sure. And some of the smaller counties, well, definitely there's just not specialists in some of the smaller counties, rural counties. So people do have to travel. But I think there are enough providers. And that's obviously something they work on to make sure so many providers are available per how many members there are. But yeah, and that maybe you can tell from looking at the provider directories. The provider directories are separated by counties, so it's easy to see, although some doctors, are in several counties, so, they may be in several provider directories if they have satellite offices.
Okay, let me see if there's any more questions. From Jenny, this is always a problem here in St. Augustine because we're a small town. We usually have to travel at least an hour to get to a specialist.
Yeah, that's true. And Jacksonville has so many specialists up there, but they, it's so hard to find them. And even here on, through Sarasota, a lot of ours are up in Tampa, or there's more down in Fort Myers, but it is hard to find the specialists, or if they travel. That was the nice thing about us. The CMS plan previously had the clinic, so the doctors would travel to us rather than having the families travel to the doctors. But well, we don't have that anymore, so unfortunately. But right, and there is supposedly a limit of how far you should be required to travel. But if there's a certain provider you want to see and they're farther than that limit, I think they try and keep it within an hour for travel. They don't, like Medicaid doesn't consider that to be too unreasonable. But still, if the provider's not in your area, you do have to travel. The specialists, it's difficult. Yeah, they're just not there. It's in some cases it's not because there's no plan providers, there's just no providers.
And one thing, just to clarify, I think this is just with CMS. If so, a lot of families need to come to Sarasota to get the evaluation, and they're coming from other parts of the state. CMS would pay for hotel. There's
yes, there is an extra benefit. It has to be approved ahead of time. They have certain places where people stay, I guess. I don't know exactly where these places are, but if you are traveling and you need to stay overnight, like we have kids that go up to Gainesville for services. And so some of those families have been able to get like a hotel and meal allowance in order to make that travel, a little more worthwhile.
So someone had asked, how do you go about getting those travel allowances?
Oh, so that would be something you would talk to the case manager about. And then I think they have a team that actually works on the travel between transportation, because even the transportation, you can go within the state, get transportation across the state if you had an appointment. And then in that case, probably it is something you would want to consider asking for a hotel or meal allowances. So they have those benefits available, but you do have to ask for them and work with the case manager to see what can be covered. Yeah, I won't say it'll be just covered for everybody, and it's something that has to be approved ahead of time.
All right, I don't think I see any more questions. So I'm going to stop the recording now. So here we are.